My name is Matthew Dodd. I'm the clinic manager of Health East Spine Center. I'm new to Health East. I've been here going on 3.5 months. I'm brand new to Minnesota. My previous position, I was a clinic manager of a family practice clinic in Des Moines, Iowa for Mercy Medical Center. Before that, I was a CMA for a neurology clinic. So I have some neuro background as well as family practice background. Everything we do in the scope of two things: patient-centered, what adds value to the patient experience, and what adds value to our team. What strengthens the patient, what strengthens the team. That's what we're about here. Our vision is to redefine spine care, to be the #1 choice for spine care in the Twin Cities metro area. That's our vision. So we are part of Health East, so we have our core behaviors, and we have the overarching vision and purpose of Health East, but we wanted to define that for ourselves. What are we going to do that goes above and beyond what Health East stands for to redefine the way spine care is delivered? This is the physical therapy room. We call it the activity center. We have Optimum Physical Rehab, physical therapy. They are owned by Health East. They have multiple sites. This site in particular is unique in that it is for spine, back, and neck patients. We want real-time feedback. So if the provider is seeing a patient, they determine that they have physical therapy, we want to be able to have them to be able to get in the same day. They can walk the patient up to the physical rehab, introduce them to the therapist, and really in real time get feedback. Leave them here in the hands of the physical therapist, then come and check on them to see how they're doing and to get some real-time feedback on their therapy. This is the care room. This is where the consult area is located. With this room, we were very intentional with what we named it. Instead of calling it a consult room 1, 2, 3, 4, we called it a care room because we provide all sorts of care in this room. And that was also staff-driven. They came up with a name for these rooms. Before the patient comes in, after the CMA, our clinical staff checks them in and preps them in this room. They will cue a provider video. So if they're seeing Dr. Kendall, they will do a little video of her introducing herself and explaining who she is and where she comes from. We have laptops dedicated that connect with the screens, so we can pull up any X-ray, diagnostic, MRI information for the patient. We pull up on the laptop, it'll automatically transfer to the screen for the patient to view in consult with their provider. This is one of 4 procedure rooms that we have. Each patient that comes in here, they can choose 2 things. They can choose the type of light that they would like for their procedure, and they can choose the type of music that they would like to listen to during their procedure. What differentiates us as far as the room is the location of the procedure room. Right outside these doors is the nurse area, and right next to that are the prep and recovery rooms. Literally within steps, the physician can have waiting their nurse and their clinical staff. And then within steps, we can escort the patient back out to the prep and recovery room, which we call Maple rooms. Again, kind of like the care rooms. We want to describe not what we do, but what the patient experience should be like. So since we're located in Maplewood, Minnesota, we have 14 prep recovery rooms, which we call Maple. The model is that we want the clinic to be a clinic without feeling like one. So we've taken great care to make patients not feel like they're in a clinic. We want it to be warm, we want it to be soothing, we want it to be a very calming experience. The types of patients we have they come in, they have pain, back pain, neck pain, they're hurting. So we wanted to do everything we could to make them feel calm and soothing because a procedure can be a scary thing.